In particular, this hearing is a chance to hear from private sector innovators who have taken this cause to heart and are seeing real-world results. When I talk about delivery system reform, I point to 5 priority areas: payment reform, primary and preventive care, measuring and reporting quality, administrative simplification, and health information technology. As I expect the experiences shared by today's witnesses will confirm, these priority areas should not and do not stand alone and apart from each other. Rather, progress in each area will influence and be influenced by progress in the other areas in a manner that can drive virtuous cycles of improvement in care, efficiency in delivery, transparency in information, and reduction in cost. The potential cost savings in delivery system reform are significant. The President's Council of Economic Advisors estimated that over $700 billion a year can be saved without compromising health outcomes. The Institutes of Medicine put this number at $765 billion annually. The New England Healthcare Institute reported that it is $850 billion annually, and the Lewin Group and former Bush Treasury Secretary Paul O'Neill have estimated the delivery system reform savings at $1 trillion a year. We can reduce costs and improve quality, health outcomes, and patient experiences. It is a true win-win. My interest in delivery system reform dates back several years. As Attorney General of Rhode Island, I founded the Rhode Island Quality Institute to develop innovative approaches to delivering health care in Rhode Island. I worked to support the inclusion of smart delivery reforms in the Affordable Care Act of 2010, and I recently released a report which assesses the administration's implementation of the delivery system reform provisions of that law. I submitted this report to the Help Committee in March. The report finds that the administration is working hard to implement the Affordable Care Act and has moved forward on 25 out of the 45 delivery system provisions in that law. For example, the administration is moving forward with programs to move us away from the inefficient fee-for-service model, such as the Hospital Value-Based Purchasing Program and the Hospital Readmissions Reduction Program. These are excellent examples of how the Affordable Care Act is helping to realign incentives to focus on the quality of services provided, not the quantity of services provided. It is important to note that a significant portion of the provisions that haven't been implemented are stalled not due to executive inaction, but due to lack of congressional action to ensure adequate funding. It's been less than 2 months since we released the report, and I'm happy to report that progress implementing the Affordable Care Act has continued. Since March, the administration has selected the first 27 accountable care organizations in the Medicare Shared Savings Program, selected 7 markets to participate in the Comprehensive Primary Care Initiative, announced the first 16 states to participate in the Independence at Home Demonstration Project, released the first 26 Healthcare Innovation Challenge Awards, and increased Medicaid payments for primary care physicians. These recent developments, like others that are well underway, show how the Affordable Care Act is promoting innovation throughout our healthcare system. My report largely focuses on the Affordable Care Act's delivery system reforms, but it is important to learn from the efforts of the private sector. While increasing healthcare costs are the primary driver of our federal debt and deficit, they are not unique to government health plans. Costs are going up for everyone, whether they're insured by Medicare or Medicaid, the VA or TRICARE, Blue Cross or United Healthcare. We have a system-wide cost problem on our hands, and the solution must be system-wide too. We need to look for best practices across all sectors of our healthcare system to inform our understanding of what is working on the front lines of reform. That is why I look forward to hearing about the private sector efforts of our first two panelists. While the Affordable Care Act is pushing the federal government towards delivery system reform, the delivery system reform movement has been driven by dedicated providers, payers, employers, and some states that have worked for years to improve the quality, safety, and effectiveness of care. These stakeholders have pioneered new delivery systems that encourage providers to better coordinate care and reduce waste and inefficiency. Today's hearing is not an exercise in discussing hypothetical improvements and theoretical cost savings. Our first two witnesses will show how their delivery innovations have resulted in real improvements to quality, real improvements in patient outcomes, and real cost savings. The advantage of this approach is that it does not rely on shifting costs or cutting benefits. Rolling back federal health benefits would do little to address the underlying cost problems in our fragmented, inefficient healthcare system. Last spring, Gail Walensky, who ran Medicare and Medicaid under President George H.W. Bush, said, and I quote, "If we don't redesign what we are doing, we can't just cut unit reimbursement and think we are somehow going to get a better system." From the private side, George Halvorson, the president and CEO of Kaiser Permanente, joined me at a discussion on the future of healthcare last year, where he said something very similar. I quote, "There are people right now who want to cut benefits and ration care and have that be the avenue to cost reduction in this country, and that's wrong. It's so wrong, it's almost criminal. It's an inept way of thinking about health care." Before I introduce the first witness, I'd like to express my deep appreciation for the work and experience that today's panel brings to this discussion. Putting these types of reforms into practice takes guts, vision, and determination. Putting them into practice successfully requires strong leadership and tireless commitment. I hope that today we can draw from the lessons that you have learned, and I look forward to continuing this conversation with my colleagues in the Senate.